uh, the screen. Okay, you see the screen now or not?
Oh, yes, Prof. Can
Uh,
see this.
all right. Okay. So again, we start by anatomy. I am Dr. Shireen Al Hariri. Nice to meet you. This is course is a revision course for most of the topic, most of the recall. We started by anatomy, physiology, pathology. After that, general surgery, and all topic of specialty like vascular, orthopedic, and others. So today we start by anatomy, and the first thing in anatomy we start is upper limb. In the exam, anatomy question is 75 question, so it's out of 300 questions, so it is a big bulk of question. Upper limb, about 8 questions. So we can start. I read the first question. After that, Shalash and Rashad read. An 80 years old man dislocated his shoulder. It is reduced in emergency department. On review 3 weeks later, he is unable to initiate abduction of the shoulder. So this is question he asked you, what is the muscle responsible for initiation, abduction of shoulder? Anyone have an idea? Which muscle is responsible for initial abduction or abduction till 18 degree?
Supraspinatus, Prof.
Yes, the correct answer is supraspinatus, initiate abduction, followed by deltoid, then rotated cuff. So deltoid make it 90 degree. After that, rotation by rotated cuff. Okay, the second question, 35 years old man, full and sustained fracture of middle third of his clavicle. Which vessel is the great risk of injury? So if you have fracture in the clavicle, middle third of the clavicle, so which vessels can be artery, can be vein, can be injured, or which superficial vessels can be injured? You can see the picture here. Of course, we have the artery, we have the vein, and the veins is the most prominent or most superficial. So what's your answer?
The subclavian vein.
To subclavian vein. So this is asked about the superficial fracture or superficial structure or structure just lays just below. You can see the clavicle. You can see attachment of the clavicle to the manubrium. So this junction is the site of fracture and is related anatomically to subclavian vein. Okay. 33 years old man sustained an injury in his forearm and wrist. When examined in the clinic, he is unable to abduct his thumb. Which nerve is most likely to have been injured? So he need to ask abduction of the thumb by adductor pollicis muscle. So we need to know what is the nerve supply of adductor pollicis muscle. And we have a lot of nerve here, radius, ulnar, median. So what is the nerve supply of adductor of the thumb? Anyone have an idea?
It's ulnar nerve, Prof.
Ulnar nerve, yes, deep branch of ulnar. As you know, that short muscle of the thenar muscle supplied by median, but adductor, which is one of the short muscle, we don't consider as a thenar muscle, although it is in thenar area, but it is the nerve supply is from ulnar nerve. Okay, so this is important to know that. After that, a man sustained lacerations between the base of finger and wrist several weeks after injury. This loss of the thumb adductor power. It is the same scenario, like something in abduction. Which nerve is most likely to be injured? So it is the same scenario. The patient have something in adductor of the thumb. So the same answer, which is deep ulnar nerve. Of course, some topics came many times with different topic. Next question, and it is common. He asked about what is the course of median nerve related or relative to brachial artery in the upper arm. Of course, when you study anatomy, you must have picture. You can use Ackland, you can use Get Through Anatomy, you can use any text you have. And if you see this picture, you can find this brachial artery. And they have two major nerves. Medial nerve first is lateral, cross in front, and become medial. Ulnar nerve, although his way is medial, but disappear because it is passed below the or behind the middle epicondyle, so not appear in cubital fossa. So you can ask about radial, you can ask about median, you can ask about brachial artery, you can ask about ulnar. Here the question is, what is the course of median nerve relation to brachial artery or relative to brachial artery? So he asked about median nerve. So as you see here, it is lateral, front, medial. So the answer here is lateral and anterior and medial. If change the question, what is the course of the ulnar nerve relative to brachial artery? So it is medial side all over this course. So it is important to have a picture. It is important to show the picture. Just remember. Again, this is in cubital fossa. You can find brachial artery. You can find medial nerve. Here we don't find the ulnar because the ulnar is vast behind the middle epicondyle. 21-year-old man stabbed in antecubital fossa. Decision is made to surgically explore the wound. During the operation, the surgeon dissected down into brachial artery, which nerve identify medially. So here, you need to ask which nerve is medial to brachial artery. If you come to the picture again, so this is the brachial artery, and he asked about what is this nerve, and again this nerve is medial nerve. So the answer here is medial nerve. Okay, so you can review the two picture. You can find medial nerve lateral, anterior, middle, ulnar nerve middle through all the course. In cubital fossa, the ulnar nerve disappear, it pass behind the middle epicondyle, but medial nerve is still medial to brachial artery. So this area is important because in trauma, in drug abuse, in intravenous injection for superficial pain, sometimes you can go deep and injure brachial artery. Next question, 53 years old lady recover following modified radical mastectomy, axillary node clearance for carcinoma of the breast. She complained of shoulder pain. On examination, his winging of the scapula, nerve supply of which muscle is most likely to be injured. So usually, sometimes after axillary clearance or trauma to axilla, the patient have winging, means the axilla, the scapula become outside. So this is due to paralysis of the muscle. And he asked about what is the nerve supply of this muscle. First, what is this muscle? Anyone?
Serratus anterior.
Yeah, so it is serratus anterior and can cause winging of the scapula. Okay. 23 years old, the climber full and fractured his humerus. The surgeon decided upon posterior approach of middle third of bone. Which of the following nerve is great risk to be injured? In this area also, you need to show the picture of the humerus, and you can find the humerus have 1, 2, 3 nerve. Again, in the top axillary nerve around it in anatomical neck, and radial nerve behind it, what we call it surgical neck, and ulnar nerve behind middle epicondyle. So you can find, for example, in fracture here affect the axillary nerve, which supply to deltoid muscle, radial nerve, which supply the extensor of the forearm, and ulnar nerve behind the middle epicondyle and can be fractured in supracondylar fracture. Again, you can find here the three nerve, ulnar behind, median in front, and radial in this way come from medial to lateral. So here, posterior approach. So the answer is anyone? If you go to posterior, you can find here radial nerve. So the ulnar is injury, following nerve great risk is radial nerve. After that, we back again, 38 years old man presented clinic with shoulder weakness. On examination, he can't initiate shoulder abduction. And again, we mentioned before, initiation of abduction is by supraspinatus muscle. But here he asked about the nerve supply of it, which nerve listed below is least likely to function normally. So he need to ask which nerve supply supraspinatus. Of course, the nerve supply supraspinatus is suprascapular nerve. Suprascapular nerve supply two muscle, supra and infraspinatus. So again, initiation of abduction is by supraspinatus muscle. Supraspinatus muscle supplied by suprascapular nerve. It is important when you study through anatomy, if you found the nerve like this, you're looking for what other muscle supplied by suprascapular nerve, which is infraspinatus nerve. Next question, very common. 53 years old lady present with pain discomfort in the tip of finger. She's work as typist and notice the pain is worse when she is working, especially at night. Her little finger is less affected to the pain. Of course, this nerve listed or this condition is the carpal tunnel syndrome. Carpal tunnel syndrome is affection of medial nerve, affects the tip of finger, except the lateral, which is half of the little finger and half of the third finger or fourth finger, which is uh, ring finger. Okay, so little finger is less affected, and this is carpal tunnel, so it is medial nerve affection. It is carpal tunnel syndrome. Okay, so it is a little on the finger behind. Okay, before it. Next question: which of the following muscle lay medial to the long thoracic nerve? Long thoracic nerve is one nerve you can see in the mastectomy or axillary dissection, axilla dissection in axilla. So it is important to know is long thoracic nerve supply muscle, which is serratus anterior, and again serratus anterior can cause winging of the scapula. So it is important to protect to avoid injury of long thoracic nerve during breast resection. 43 years old typist presented with pain in the dorsal aspect of upper part of forearm and weakness when extend her finger. On examination, triceps muscle is function normal. Of course, the triceps, as you know, supplied by radial nerve. There is weakness of the most of the extensor muscle. In general, extensor muscle either supplied by radial nerve or branch of radial nerve, which is posterior interosseous. However, there is no sensory deficient. Of course, the affection of the radial nerve have not much affected because the only area can be affected is this area, is the web space here. Can only area can affected in the radial because of the overlapping of the nerves. So he need to know, to tell you that the radial nerve is intact, sensation is intact, but still extensor is not working good. So the nerve is affected here is not the radial, but affects the extensor. So the answer is the posterior interosseous nerve. So it is important to know all extensors of the forearm, the triceps muscle is supplied by radial nerve and posterior interosseous. Next question is 28 years old teacher report difficulty with writing, no sensory loss. She now have apparent accessory of flexor pollicis longus muscle. This is a rare disease diagnosed by MRI, but he need to ask which nerve is likely to be compressed. He need to ask which nerve. He need to ask which nerve is likely to supply this flexor muscle? And the answer here, it is the flexor muscle is supplied by anterior interosseous nerve. So this is the main supply of the flexor. So the answer is anterior interosseous nerve. Next question. A 35 years old tennis player attended reporting tingling down his arm. He says that he was hit very hard by tennis ball in the back of elbow. Back of elbow is this area. This is the back. So this is area of olecranon fossa. Okay. So they have problem in the back of the elbow, weakness in the abduction and adduction of the extended finger. Abduction and adduction is this movement. So this is abducted, abduction, 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 like this. Okay. So we need to ask about, so in this question is mainly asked about the muscle affected adduction and abduction of fingers, and this is interossei muscle, and all interossei muscle is supplied by, anyone know what is all interossei muscle supplied by?
Ulnar.
Ulnar. So all interossei supplied by ulnar. So whatever, any finger, any number. So interossei, all interossei supplied by ulnar. So the correct answer is ulnar. Okay, next question. 62 years old man presented with arm weakness. On examination, they have weakness in the elbow extension. So elbow extension so is related to radial nerve. Loss of sensation in dorsal aspect of the first digit. This is area what we described before. So this area, this web space, this space between the first interspace or first space, and it is the first digit, dorsal aspect of first digit, thumb, which the nerve listed below is more likely affected. So this is clear, it is radial nerve affection. Okay. Next, 56 old mechanist. He has arm interact in steel grinder and is brought to emergency department. On examination, he is unable to extend metacarpopharyngeal joint and abduct his shoulder. He has weakness in elbow and wrist, which is most likely injured. So in this situation, we have combination. So unable to extend, so extensor is affected. Abduct the shoulder, abduction of the shoulder, and has weakness of the elbow and the wrist. So all the extensor is affected. It means this patient have injury of the main or the above the radial. So it means that have the posterior cord of brachial plexus injury, because as you know, the radial is arise from the posterior cord of the brachial plexus. So the answer here is the posterior cord of brachial plexus. Next question, 23 years old man fall and injured his hand. There is concern that he may have scaphoid fracture. You know, scaphoid fracture, one of the critical and important topics, as there are tender in his anatomical snuff box on clinical examination. Okay, the question here is different. He need to ask you about what is the boundaries of the anatomical snuff box, or what is the medial border or medial border of anatomical snuff box. And again, anatomical snuff box, as you see, is have medial border and lateral border. So it is important to know anatomical snuff box. Of course, the medial border is by extensor pollicis longus, and the lateral border is extensor pollicis brevis and abductor pollicis longus. So we have two in lateral and one muscle in medial. he here asked about middle border. So the medial border is extensor pollicis longus. The lateral border, extensor pollicis brevis and abductor pollicis longus. So extensor pollicis brevis, abductor pollicis longus is the lateral border. Extensor pollicis longus is the medial border. Next question, 18. 42 years old lady has had an axillary node clearance. Axillary node clearance for breast malignancy. Post-operative, she reported weakness in the shoulder. She is unable to push hair forward from the wall in the right arm, and scapula is pushed out medially from the chest wall. So what we need to explain, you know that if you push the wall like this is the action of serratus anterior muscle. So he need to explain to you this patient have problem of the serratus anterior muscle, and serratus anterior muscle is supplied by long thoracic nerve. So again, if you ask about winging of the scapula, so it is injury of the serratus anterior. The nerve supply of the scapula is long thoracic nerve or nerve to serratus anterior. Next question. 36 years old man is admitted for elective surgery for lymph node biopsy in supraclavicular region. Post-operatively, the patient have difficulty to shrug his shoulder. Shrugging his shoulder is like this. Shrug the shoulder. Shrugging the shoulder is the action of trapezius muscle. So it means that trapezius is not good. Trapezius muscle supply, anyone know trapezius muscle nerve supply is?
accessory nerve.
Accessory nerve. And again, when you study this, you know, accessory nerve give trapezius and sternocleidomastoid muscle. That's it. So it is important when you study anatomy to have a picture. It is important when you study anatomy, if you have something like this, okay, so this patient unable to shrug his shoulder, so it is accessory nerve. So accessory nerve also supply other muscle, which is sternocleidomastoid muscle. Okay. A woman developed winging of the scapula again following Batey mastectomy. Batey mastectomy is modified radical mastectomy in which you just cut the pectoralis minor insertion. Which one of the following injury during axillary dissection can be caused? So again, is the winging of the scapula. It means that the paralysis of serratus anterior muscle. It means that long thoracic nerve is injured. So you can find the same question is come by different way. 21, 17 years old male complained of difficulty using his left hand after distal humerus fracture many years ago. On examination, this diminished sensation overlying the hypothenar muscle or hypothenar eminence and middle 1.5 finger. What is the most likely nerve lesion? So in this situation, we speak about this site. So suppose anatomical position like this. So we speak about the lateral one. So they have something here. So this is area is mainly by ulnar nerve. So he asked about hypothenar muscle. So we know thenar, hypothenar. So which nerve is affected? So this is area by ulnar nerve. So again, this is area by ulnar. Tip of fingers is by medial nerve, except the lateral 1.5. A patient presented at the clinic following surgical procedure. She complains that she unable to shrug again his shoulder with most likely underlying nerve. So again, it is long thoracic. Shrug his shoulder. So it is a spinal accessory and it is affection of the trapezius muscle. A man has direct trauma from a knife that caused wound about 8 cm from delto pectoral groove to the middle of chest wall. Which of the following not risk of injury? Okay. So This is area is important because delta vector group is the site we insert central line. Can have some trauma. If have trauma, so most of the organ like cephalic veins, axillary artery, muscle, of course, cord, nerve, but not the root of brachial plexus. So the only far away is the shoulder joint capsule is far away. So the answer here is shoulder joint capsule. It is just you need to know the superficial anatomy of this area. The next question, 23 years old man suffer from compound fracture of distal third of the clavicle. During game of rugby, she is evidence of arterial hemorrhage. Which of the following vessels is directly related to the site of fractures? Actually, this is important question because this is artery which is injured in this area is very small artery. I think I have a picture down. Yes. Okay. If you see here, you can see here very small artery called thoracoacromial branch. Although this is a branch of the axillary artery, you can find the axillary, so can find branch we have first, second, third branches, but this is branch not important, but can be easy injured because as you see here, it is very tiny branch and have many small branch and is difficult to be injured. So if you back again to the question, so they have distal fracture of the clavicle. So if we have vessels, they can be, of course, if you injure big arterial axillaries, you have horrible bleeding, usually the patient die. So this means by small artery. So this is thoracoacromial artery. It is common to be injured in mastectomy, in trauma in this area, in penetrated injury. So it is important to recognize that is tiny branch and have 4 branch, very small branches. 23 years old man is involved in fight and has laceration in the posterior aspect of the right arm, 2 cm proximal to olecranian process. He's unable to extend his elbow. So again, extension of the elbow usually is by radial nerve, but here he's not asked about the nerve, he asked about the muscle. So it means that which muscle or important muscle can extend the elbow supply by radial nerve, and the answer, anyone knows the answer? Extensor of the elbow is mainly by triceps muscle.
Triceps.
Triceps, thank you. So it is triceps muscle. Okay. 32 years old man stabbed in the neck and the lower trunk of brachial plexus is injured. Lower trunk. So what is the movement listed below not affected? So he asked, what is the listed not affected? So it is important in this question. It is important you put in your desk this brachial plexus. So you can find the picture of this brachial plexus here. So what you see here, you can find that he asked about the root, the lower root. So the lower root is here. So the only something from not from the lower root is the suprascapular nerve. This is upper trunk, middle trunk, lower trunk. So they have affection in the lower, not upper. So what is preserved is suprascapular nerve. If you remember again, suprascapular nerve gave 2 muscles, supraspinatus and infraspinatus, and supraspinatus is essential for initiation, abduction of the arm. So the answer here, if you come to back to the question, is the lower trunk. So stabbed in the lower trunk. So the suprascapular is not from the lower trunk, it is from upper trunk, so it's not affected. Okay, so it is important to put in your desk just picture of the brachial plexus, lumbar plexus, all this because it's important in the nerve distribution. Which nerve supply interossei of four fingers? This is tricky question because all interossei again is supplied by anyone
Ulnar.
ulnar nerve. So whatever he say one, two, three, four interossei. So all interossei supplied by ulnar. So the deep ulnar or ulnar nerve is the correct answer. Okay, 24 years old man fall and sustained fracture through scaphoid bone. Which is the following area of scaphoid main blood supply? It is important to know scaphoid bone is one of bone can have a vascular necrosis because they have something different in the blood supply because usually the blood supply is came from the distal end. So the blood supply from distal end, so they have a vascular necrosis. It is common. Other bone can have vascular necrosis like neck of femur. So both are very common to have a vascular necrosis. Next question, in order to expose the right axillary artery, right side, it is important to know usually in upper limb when you speak right and left, the only difference between right side and the left side is an only thoracic duct because thoracic duct in the left side. Apart from that, the anatomy is the same. So thoracic duct is out. Right axillary artery transverse incision is made below the clavicle from sternal end of the clavicle to deltopectoral groove. So what is the following structure would be encountered the dissection down to the vessels? So all the other structure like phrenic is so deep, suprascapular is lower, thoracic duct left side, lateral thoracic is away. So the only structure you can find is thoracoacromion artery. So again, thoracoacromion artery is important, not as artery is important and can be injured during surgery. The last question we have is 20 years old man presented to emergency department with a stab injury in senar eminence. On examination, they found have 2 cm long laceration, loss of sensation of the thumb and index, weakness of the senar muscle. So he need to ask what is the nerve supply of senar muscle. Senar muscle supply by medial nerve as a motor, and the skin over is supplied by medial branch or sensory branch of medial nerve. So the answer here is C, sensory and the motor branch of medial nerve. Okay. This is last in the upper limb, but what we need to know, I will send you the answer. I will have the record we put in the YouTube. I'll give you the link of the YouTube. It is important to know dermatome and the myotome. It is important to know brachial plexus and what is arise from upper trunk or what arise from the cords, what arise from the root. It is important to know the boundaries of anatomical snuff box. It is a muscle, of course, boundaries of this anatomical snuff box. It is important to know innervation of the hand, as you see here. And it is important to know axillary artery branches. This is what you need to know from upper limb. Okay. So any question so far? Okay. So after we finish today or maximum tomorrow, I will send the answer in WhatsApp group, and also I will send you the link of record. Okay. After that, we have a lower limb. Before we start, is anyone apply for January exam? Okay, you see the lower limb now or need a share? Okay, we have one. You see lower limb or I need to share? I think I need to share.
Haven't, Prof.
All right, so you have it again.
Uh,
So,
okay, yeah. Now,
all
now it's
right, okay. So again, as we mentioned before, anatomy in the exam, exam is 300 question. Anatomy part is 75 question. So it is a big bulk, maybe is very important topics. And the anatomy also is easy because anatomy is all or none. Because if you ask you the nerve supply of any muscle or the blood supply of any organ is not a matter of debate. It's not like a physiology, for example, you have a debate, you have controversy. So it is important to study anatomy well. To study anatomy, to study question in anatomy, you must have a picture. You must have atlas. It is better to have anyone use it before, like Ackland, Macman Atlas of Human Anatomy, Get Through Anatomy, grants, whatever you have, or any topics you can download it. So it is important in any question, you're looking for a picture. Even when we put a question for exam, we look into the picture because anatomy without see a picture is very difficult. Okay, so back again, we start by lower limb. Okay. So, Dr. Rashad, you can read. Okay.
Okay, first question. Where
Yes.
should the needle be inserted to gain the sample ABG, arterial blood gas, from the femoral artery?
Okay. So this is important topic because you know that we have two landmark here. We have anterior superior iliac spine. We have either symphysis pubis or pubic tubercle. Of course, when you take a sample for femoral, you have midway between anterior superior iliac spine and symphysis pubis. So we called it mid inguinal point. This one, mid-inguinal point. So the answer is mid-inguinal point. But if you feel the deep ring of femoral hernia, it is between 2 points, which is anterior superior iliac spine, which is point, and the pubic tubercle, it is point, so it is 2 points, so it is midpoint. So midpoint means that it is in between the same, so the right side equal to the left side. So the femoral sampling is taken from mid-inguinal point, which is between anterior superior iliac spine and symphysis pubis. Symphysis pubis is not a point, it is an area. But of course, you feel the pulsation, so it is easy. Okay, thank you, Rashad. Can you read the second one?
Okay, a 34-year-old man has shot in the posterior inferior aspect of his thigh. Which of the following is the most lateral aspect of the popliteal fossa? Most lateral, it's not the popliteal artery, not the popliteal vein. Most lateral will be the common peroneal nerve.
Okay, so again, the easy way is just looking for picture of popliteal fossa. So you can laterally, you can find what is the deep, what's superficial, and what is laterally. Laterally, here is the nerve, common peroneal nerve. Anterior or superficial, not anterior, superficial is tibial nerve. Deep is the artery in between the vein. So it is important to know the boundaries of popliteal fossa. So back again, so is the question is asking about uh, lateral aspect of popliteal fossa, and it is nerve, which is common peroneal nerve. This nerve, when injured, they have drop of food or food drop, and it is he supply peroneal muscle, peroneus longus and brevis. Okay, next question.
Which of the following forms the medial wall of the femoral canal? Medial wall of the femoral canal.
Okay, so we have a picture again. So it is important, very, very common question because femoral hernia common in England, especially in overweight, obese, old female. So he asked about medial border. So we can found this is the femoral canal and the medial border is lacunar ligament and laterally femoral vein, and more laterally femoral artery. And the function of the femoral canal is to expand or space or dead space to expand the femoral vein during exercise or during cycling or during running. So it is potential space, contain only lymph node. So the answer again here, what is the medial wall of the femoral canal? So it is a lacunar ligament. Is very, very common question. It can maybe more than 20 times in exam. Okay, of course, this is diagram. Just remember the boundaries, what is more lateral and which is the vein. Okay, next question.
Which of the following nerves pass through the greater and lesser sciatic foramina
Yeah.
through the greater and lesser sciatic foramina.
It may be difficult, but it is beyond the nerve. So again, also we need to have a picture. I don't have a picture, but it's important to have a picture. Okay. So next question, also in the popliteal fossa, so you can read it.
65-year-old man with long-standing AFib develops an embolus in the lower leg. The decision is made to perform an embolectomy through a transpopliteal fossa approach after incising the deep fascia. Which of the following structures will the surgeon encounter first when exploring the central region of the popliteal fossa? Will be the popliteal vein.
No. If you come to the
Uh,
picture again, what is the more superficial?
tibial nerve.
Tibial nerve. So again, it is important to see the picture. It is important here. It is not anterior. It is superficial because anterior means the anatomical position. So sometimes, if tricky, if I ask you in popliteal fossa, what is the anterior structure? Actually, the anterior structure is a popliteal artery, and the deep structure is popliteal artery. But this is superficial. So the tibial nerve is superficial because you put the patient in broad position, which is against or reverse of the anatomical position. So it is tibial nerve. Okay. Popliteal fossa is somewhat tricky, but again, lateral border is a common biliary nerve can cause foot drop. Anterior or superficial, not anterior, superficial structure is tibial nerve. Deep structure, which is anterior, is popliteal vein, and medial is semitendinosus semimembranosus. All right, next question.
A 24-year-old lady is stabbed in the buttock following the injury. The wound is sutured in the ED. 8 weeks later, she attends the clinic. As she walks to the clinic room, she has a waddling gait and difficulty with thigh abduction. On examination, she has buttock muscle wasting. Which nerve has been injured? This one, um, I think this one will be the inferior
Okay.
gluteal nerve.
No, which muscle first is affected? It is gluteus medius muscle. Gluteus medius muscle is supplied by
Superior.
superior gluteal nerve. Superior gluteal nerve is supply gluteus medius and the minimus. Inferior gluteal supply gluteus maximus. But is this is Trendelenburg test or waddling gait or examination for orthopedic, we look into superficial gluteal nerve and looking for gluteus medius muscle. I think many question in this also. Okay, Shalash, you can read the next question.
All right, bro.
Okay.
A 72-year-old man has a fall. He's found to have a fractured neck of the femur and goes on to have a left hip hemiarthroplasty. 2 months post-operatively, he's found to have an odd gait. When standing on his left leg, his pelvis dips on the right side, and there is no foot drop. What is the cause?
Okay,
Uh,
so we mention here no foot drop to exclude what?
so you can exclude a common peroneal nerve injury.
Okay, our branches from common nerve from sciatic nerve. So what is this patient have? It is the
This
same
patient,
question.
yeah, he probably have a damage of his superior gluteal nerve.
Yes, supergluteal nerve again because of the paralysis of the gluteus medius muscle. So Trendelenburg is test is very important in the orthopedic examination, very important in exam. It is important to know superficial gluteal nerve supply, gluteus medius muscle. This is the test. Trendelenburg test when you ask the patient to stand normally in one leg, like this leg, so the other is up. So the other side is up. But in the positive Trendelenburg, the other side, which the patient not standing, is down, not up. So the normal, you stand in the, for example, right leg, the left hip is up. If the patient have paralysis in the right side or weakness in the right side, so the other is dropped down. So it's called Trendelenburg sign, very, very important. Weakness of the side abductor, mainly gluteus medius and the minimus, both supplied by superior gluteal nerve, lumbar 5, S1 and 2. The test, of course, is standing in one leg. Okay, next one.
Which of the following ligaments contain the artery supplying the head of the femur in children? This would
Okay, it is
be,
in children. Yes.
yeah, so this one would be ligamentum teres.
So it is ligamentum teres because it is in children. After that, the blood supply is mainly through reticulum blood supply, and it is important for avascular necrosis in the supratrochanteric fracture of neck of femur. Okay, next question.
Which of the following structures lie anterior deepest in the popliteal fossa? So from the picture earlier, it would be popliteal artery.
Okay, I just add deeper, but usually in exam ask you what is the anterior structure. So the anterior structure again, if you have what we don't have it here, the anterior structure again is popliteal artery, not tibial nerve. I just bring it up, 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 up. Yes. Okay. So it is the deepest or the anterior because this is anatomical position. It is tricky. Just to remember that we follow the anatomical position. Okay. Next question.
A 42-year-old lady is reviewed in the outpatient clinic following a routine surgical procedure. She complains of diminished sensation at the lateral aspect of her foot. Which of the following nerve is likely to be affected? Lateral aspect of foot would be sural nerve.
Yeah, sural nerve is lateral aspect of the foot is sural, and middle aspect, which is big toe, is the saphenous nerve. Saphenous nerve is a branch from femoral nerve. Innervation or superficial innervation is very important. Okay, next question.
A sprinter attends A&E with severe leg pain. He had forgotten to warm up and ran a 100-meter sprint race. Towards the end of the race, he experienced pain in the posterior aspect of his thigh. The pain worsened, localizing to the lateral aspect of the knee. The sprinter is unable to flex the knee. What structure has been injured? Um,
Okay, here you need to ask about the flexor of the knee. Flexion of the knee is mainly by which muscle? Of course, it is muscle, not ligament. So the flexor of the knee is by biceps femoris muscle or biceps femoris tendon. Okay, so the answer is biceps femoral tendon. Again, Trendelenburg test. You can read it.
all right. A 23-year-old lady is undergoing a Trendelenburg procedure for varicose veins. During the dissection of the saphenofemoral junction, which of the structures listed below is most liable to injury?
This is
This would be
difficult
the
question. What?
it would be the pudendal artery.
Uh, Deep external pudendal artery. Okay, yes. If you see this picture, it is large. This is the saphenofemoral junction. And as you can see, we have this is artery can be injured. What we called it deep external pudendal artery. So you can deep external pudendal artery. Okay, so it is important to remember, although it is not important, it's very tiny. This is enlarged because we have deep and superficial. This is the superficial is up related to inguinal region. So this is the deep external pudendal artery. It is important to recognize it during femoral saphenofemoral disconnection, what we call the Trendelenburg operation. It is done for varicose veins. We do stripping now till the knee, not below the knee. And below the knee, we make multiple stripping to avoid injury of saphenous nerve, which is branch of femoral nerve. Okay, so again, in Trendelenburg operation or saphenofemoral disjunction, the artery can be face is deep external pudendal artery. Colligated is not important. Okay, next.
A 30-year-old man presents with back pain, and the surgeon tests the ankle reflex. Which of the following nerve roots are tested in this maneuver? This would be S1 and S2.
Okay, so it is important to know the ankle reflex is S1, S2. Okay, all right. Next.
The The integrity of which muscle is assessed by the Trendelenburg test, gluteus medius.
Yes, and the nerve supply is superior gluteal nerve.
Gluteus
Okay,
superior gluteal nerve.
okay. Next one.
Which of the following muscles is not within the posterior compartment of the leg, lower leg?
Mhm. Okay,
Uh-huh.
I discuss, I tell you what is the posterior compartment first. So
Sure,
if you
Prof.
go to the posterior compartment, you know that in the leg we have four compartments. Middle, lateral, and the posterior is superficial and deep. So superficial is gastrocnemius and soleus and plantaris. Plantaris may be present, maybe not, like palmaris muscle longus in upper limb. Deep posterior compartment is flexor hallucis longus, flexor digitorum longus, tibialis posterior. Just remember this. So gastrocnemius, soleus, flexor hallucis, flexor digitorum, tibialis posterior. Back to the question. So the question he asked, which is not within the posterior compartment and the rest one, two, three, four muscles. So which one not in the compartment or not in this area?
The peroneus brevis.
Yes, simply because peroneus longus and brevis is one of the lateral compartment, but soleus, flexor digitorum longus, popliteus, flexor hallucis longus is the compartment either superficial, posterior, or deep. Okay, so by exclusion, you know plantaris is lateral, so you can you can take it. All right, next one.
A 23-year-old man present with a delayed diagnosis of appendicitis. The appendix is retrocecal and has perforated, causing a psoas abscess. Into which structure does the psoas major muscle insert? This would be
Yes.
the trochanter of the femur. Well,
Yes, but we have two
is the greater or
trochanter.
the
We have
lesser?
lesser and the greater.
Yeah.
Which one? It
I'm
is
going for
lesser
a long shot,
trochanter.
Prof.
Lesser
Lesser,
trochanter.
lesser trochanter.
So it is important to know iliopsoas tendon inserted in lesser trochanter of femur. It is important why for two reasons. First, it is if you have psoas abscess due to Bot's disease of the bone of vertebral column, they pass through the fascia of the psoas and become appear in the below the inguinal ligament. This is first. Second, iliopsoas is a combination of two muscles, iliacus and psoas. Iliacus muscle supplied by femoral nerve, and it is the only branch above inguinal ligament, but psoas supplied by lumbar plexus, lumbar 1 and 2. So we have two muscle, iliacus by femoral, psoas by lumbar 1 and 2. Okay, inserted in lesser trochanter of femur. Okay, next question.
A 72-year-old lady with osteoporosis falls and sustains an intracapsular femoral neck fracture. The fracture is completely displaced. Which of the following vessels is the main arterial supply of the femoral head? This would be
Okay.
circumflex femoral artery.
Okay, yes. So you see the blood supply, you can find circumflex mean like a circle. It is like rotation, like curve. So this is the lateral femoral circumflex, or this is the main blood supply. Of course, they have good anastomosis. This is area is below the head in this area because the upper part of supratrochanteric can easy to have a vascular necrosis. So the answer here is circumflex femoral artery. Okay. Sometimes they call it lateral circumflex femoral artery. Okay, next question.
A 19-year-old man is playing rugby when he suddenly notices severe pain at the posterolateral aspect of his right thigh. Which of the following muscle group is most likely to have been injured? Bicep femoris, long head.
Yes, because posterolateral. So if you remember the
The
popliteal
question
fossa
earlier.
again, up, up, up. If you remember popliteal fossa, so what is the lateral structure? Is biceps. So if you have lateral structure affection, so it is biceps femoral tendon. So it is again important to have a picture during study or answer anatomy question. Lateral aspect, and it is long head of biceps femoris. Last question.
Which of the following bones is related to the cuboid at its distal articular surface?
Okay. In this area, you need to see the bone. He asks you, what is the following bone related to cuboid? This is the cuboid, which is in green.
Uh-huh.
So which bone, how to count the bone? You count it from big toe. So 1, 2, 3, 4, 5. So 4 and 5 is the correct answer. Here is not mentioned 4. He mentioned 3 and 5. So what is your answer?
It would be fifth metatarsal.
Okay, so again, it is important if you just look the picture, you can understand because no imagination. So just to know 1, 2, 3, 4, 5 is related to cuboid bone. By the way, when you study the food, talus have no muscle attachment, and deltoid ligament attached to all muscle. Okay, we finish this question. I just show the dermatome. It is important to know that the big toe, that web space like radial in upper limb by deep peroneal nerve, lateral superficial saphenous nerve from femoral, and this area by superficial peroneal nerve. In the lateral side, common peroneal, and after that, in the back or this area, you can find sural nerve or sural nerve in the end. So little toe, sural nerve, big toe, saphenous, and superficial peroneal nerve. Okay. Dermatome also is important, number 1, 2, 3, 4, and it's important to know that little toe S1 and big toe L4. So if the patient have disc at the level of L4, 5, so the sensation impaired in the big toe. If you have something in the level of L5, S1, so they affected the little toe. So little toe S1, big toe L4, and the name of the nerve is for big toe is saphenous and superficial peroneal, and for little toe is sural nerve. Okay, so this is all question I have. What I will send you in the WhatsApp group the answers and also the link in the YouTube. Okay.